Alrighty, welcome back to Kearsarge Valley Magazine. I am Adam Brisbane, and what we are doing now, this is a little peek into our pre-show routine. What I need to do is basically get recharged before every interview I do. I wish that was true, but it's not. We're actually going to talk to you guys today about modalities. Dr. Steve Coppola is here from Coppola Physical Therapy in Concord to talk to us about what modalities are and show us.
Sure. Thanks, Adam. I appreciate being on here.
No
there
problem.
are a lot of modalities, okay? So I guess that we pick a few here today that we'll talk about. They're tools for physical therapists. They really help us to try to get patients better, quicker, faster, stronger, you know? And maybe not stronger, but quicker and faster, and then at the end stronger. But these modalities really help to sometimes decrease inflammation, but let's go through a few of them and just let's see where we get, okay?
Yeah, no problem.
I have you hooked up on one here. It's called the TENS unit.
All right.
Okay, this TENS unit is really a great device. It's an old but tried and true unit, okay? This thing now costs $85. It used to be $1,200, $1,300. For $65, $85 now for people. This is something that they can do that helps kill pain.
This is also something that somebody should not build at home themselves, right? No internet machine mock-ups here. Get the real thing.
That's very true. That's very true. So this really has 4 pads to it, and this is how it works. I turn it on, and electricity actually goes through and goes to a point where you have pain. Say you have forearm or arm pain there. And the way that this works is it increases the amount of endorphins and enkephalins in the area. Okay, that's natural opiates in your body to help kill pain. That's one way. The other way that it also works too, it works on kind of 2 ways, is that it actually increases the amount of touch receptors in an area. Okay, because you feel a tingling going on. Well, you're not going to be able to feel it. Did anyone ever give you a punch in the arm? You when you kind of rub your arm.
I am married. Yes.
Yeah. Okay. So when you rub it, it's an automatic reaction. Well, this is kind of the rubber, okay? This is kind of rubbing. It increases the amount of touch receptors. It brings down the touch receptors. Your body can't feel touch and pain at the same time. It's going to feel whichever's more stimulated, okay? It's not a horrible feeling. It actually feels a little bit like a massage. You let me know. I'm going to turn it on for you. You let me know if you start to feel a little tingle.
Nothing yet. Oh, there we go.
You feel a little something.
Yeah. Now I feel, it's pretty much in the whole arm.
Yeah, so you would put this on for anywhere from 15, 30 minutes up to even an hour. You could have it on at a medium amount. Then I say you shut it back down afterwards. But this can immediately help kill pain. It can break the pain cycle.
Takes your mind off the pain.
It does. It breaks the pain cycle. And sometimes that's exactly what people need, is break the pain cycle and then they can start to heal. You could take this to work, okay?
Excellent.
You could have this kind of hooked up to you. People who can't take medication when they're at work, they can have a viable option for something for a painkiller.
Excellent.
So it's nice, a nice tool to have. This is one that they can get, like I said, for home use. So that's one thing here.
And now because I'm so strong and powerful though, that this is why my arm isn't freaking out, right?
Yeah.
No,
Well, there's 2 different types. This is called the TENS machine. There's also something called an NMES, which actually goes and contracts the muscles.
Yes,
okay?
that's the other one.
And that is the other one, and that's really for people who you've just had surgery, you've lost a lot of muscle bulk. We can put these pads up, and it does the workout for you. You see those people with those ab things kind of going on now that I see on commercials.
But you really can tell if you do have pain somewhere, this is going to take your mind off of it.
Sure.
Easily.
It feels like a funny massage, I'd say, right?
Okay.
All right.
So let's talk about another modality in the physical therapy realm.
Fairly new. It's been out there for a few years. Is the laser, a low-level laser, also known as a cold laser. Okay. The benefit to it is that it reaches down to a point of pain. It can get down about 5 centimeters immediately. Okay. What it does is it really targets the mitochondria of cells, which is the powerhouse of the cell, to help kind of, I call it the plunger to a toilet. You know what I mean? You got a toilet and it's kind of plugged. You flush the toilet and the water goes down real slow and kind of goes and kind of comes up. This really is the plunger that
shoves it down.
It really does. It takes that cell, it kind of compresses it, gets it kind of moving again, normalizes the cell.
Cool.
So here's the good news to it. Good news is hardly any side effects to it. Really doesn't feel like anything. That's the bad news too.
Okay.
Because people go, is it really doing something?
But it's working within your body.
It is, and it's pretty effective. The original stuff was really for carpal tunnel, and they found out it worked real well with carpal tunnel, and now we're using it for all types of strains and sprains. So pretty effective.
Let's talk about probably one that a lot of people are familiar with, the ultrasound. I know I had ankle surgery, and I actually love to go to the ultrasound thing.
Yeah.
You just sit there for 15 minutes. It's kind of that massaging, that heat type thing. So let's talk about that.
It is. The first thing is many people come in, though, and they think that they go, well, what do you see with that thing as I'm doing an ultrasound? It's not that you see anything with it. It is, in fact, what you said. It's kind of a deep heat, can get down to 5 centimeters. You have to use it for a good amount of time, probably about 10 minutes to get down to deeper structures. But it increases the blood flow of the area, help get some of the toxins and stuff that's in an area that's been injured out of the area, and helps facilitate that healing process. That's probably its best device that we've used, and it is tried and true for physical therapists. And you know what? Patients do. They do love it. They feel it right away. They can feel how it's helping them. Yep. So it's really it's a big one for us.
Perfect. Well, thank you for explaining some of these different things. I mean, sometimes there's a stigma about going to physical therapies or some of the instruments that you guys use. It's great to bring these things to light, to say, hey, they're not that bad. It's a pretty common thing, and we can help you out here. So thanks for joining us. But if somebody wanted to know more about this stuff and the other stuff that you guys do, how would they get in contact with you?
Yeah, they could certainly go on to my website, www.coppolapt.com, COPPOLAPT. Or they can give us a call, 228-7500. Be more than happy to talk.
All right. Well, my arm has never felt better ever in my life. So there you go. Back to you.